motion to come out of executive session.
I'll make that motion.
Have a second?
Second.
All right, Tim, thank you. All right, all those in favor?
Aye.
All right,
Thank you, Madam Chair. This is certification of closed session pursuant to subsection 2.2-3712D of the Code of Virginia 1950 as amended. Each member of the Board of Supervisors, upon the roll call, certifies that to the best of their knowledge, only public business matters lawfully exempt from the open meeting requirement under the Virginia Freedom of Information Act, and only such public business matters that were identified in the motions by which the closed meeting was convened were heard, discussed, or considered in the meeting by the Board of Supervisors. Any member of the Board of Supervisors who believes that there was a departure from the requirements shall state so prior to the vote, indicating the substance of the departure that in his or her judgment has taken place. Are there any supervisors who believe that this departure has taken place? Being none, if you agree that the matters heard, discussed, or considered during the closed meeting were pursuant only to the motions by which the closed meeting was convened, please signify by saying yea or yes. Tim Lovelace.
Yes.
Luann Wallace.
yes.
Carl Ray.
Yes.
David Eaton.
Yes.
Steve Brady.
Yes.
Harry Ferguson.
Yes.
Rebecca Dye.
Yes.
Ma'am, you can return to regular session.
Thank you. All right, at this time, we'll have our invocation from Jeff Todd from Edmond Memorial United Methodist Church, and will remain standing for the pledge. Thank you.
Let us all find our place of peace as we pray. Eternal God, you have known us since we were first doing flips in our mother's wombs. And because of that, we ask for your mercy upon each of us for the times we have failed you. We have gathered on this evening, Lord, to do the work of the county of Russell in this part of Southwest Virginia. And I pray that each one of us on this night can let the love of Christ shine through as we discuss and vote on this business. Every word, discussion, and vote of this board will have an effect upon your creation and creatures. And I pray that every man, woman, and child will be represented fully by their individual supervisor. As we gather on this evening, Lord, we are not absent of the knowledge that tomorrow will be a voting day in the state of Virginia. I pray, Lord, that as we gather tomorrow, we become a shining beacon for a country that is in need of healing. You have looked upon us, Lord, as we have created this divide. And it is up to us, with your knowledge and the guidance of the Holy Spirit, to heal such division. Let us begin on this evening. Let us begin with this prayer, feeling your mighty love and grace upon each of us. We pray this in the name of Jesus Christ, who lives and reigns with you and the Holy Spirit, one God, forever and ever. Amen.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, at this time, we need to vote on the approval of the agenda, but I believe we have a couple of things that we need to add to our agenda under the county administrator's reports. Do we have a motion to add these things to our agenda as items 14 and 15? We need to, please, 14 and 15, reverting the money back to our general fund, and Mr. Ray wants to, the vehicle for town of Cleveland, 13 and 14, or excuse me, 14 and 15.
I'll make a motion, we amend the agenda to reflect those two additional items.
Second.
All right, all those in favor? All right, at this time, we have some acknowledgements and have our representatives help us. First, Sue. All right, we have Castlewood High School. So Tim and Lou, if y'all would like to come down, please. We've got recognition for the Castlewood High School State Track Team, and the coach is Ms. Lott. Annalise, am I saying that correctly? Annalise White. She's not here. Zach Owens. Zayden Stafford. Well, I will read what these young folks have accomplished. Annalise White was 7th in the 400 meter. Zach Owens was 7th in the 800 meter. And Zayden Stafford was 4th in the state shot put for the state track meet. So we want to commend those children, and we'll get those to them. All right, David, if you don't care, this is Honaker High School, all girl. Yeah, Peanut too. So, yep. This is the girls all-state soccer. Our all-state soccer coaches were Trevor Coleman, Doug Hubbard, and Wilbur Johnson. If you three will come up, please. These are our coaches. Oh, here comes Sarah. Oh. All right. Coaches, y'all come on up, and then we'll step back to the other thing. Trevor, Doug, and Wilbur. And do we have anyone that needs to take pictures? All right, boys, come on. Get up here. You don't want me to have to get after you. Trevor Coleman, Doug Hubbard, and Wilbur Johnson. All right, our girls at Honaker All-State Soccer Team. Megan McCoy, second team defender. Maddie Vyers, second team forward. And Paige Fostick, second team midfield. Yeah.
I'll get on the other side.
Yeah. Y'all can tell us where you need us to be.
And then I will have to go back here a little bit. But that will do it if I can get Mr. Eaton's attention just a little bit. And Mr. Lester, yes, you say just like that. The back row looks great. Front row looks good. All right, your left seat there. Thank you.
Congratulations.
All right, any parents or grandparents want to take a picture real quick? Parents or grandparents want to take pictures? All right. Grandparents. Boys, stay up here. All right, now our young men from Honaker High School. Chandler Hubbard, first team forward. Dylan Shortridge, first team defender. Matthew Ball, second team forward. And Nick Goodman, second team midfield. Yeah, come on up here, fellas. And parents or grandparents, if you want to take pictures also.
All right, just get this Yeah, I might have to, but this side is blocked a little bit, so.
They don't need my pictures, these boys.
Okay, that looks better. Okay, 1, 2, 3. All right, thank you.
Parents or grandparents, and go and take pictures. Got 'em? Okay, good job. Oh, okay. Practice and bow. Next, we have a recognition for a lady. She has been with the Russell County Department of Social Service for 40 years, Miss Annette Patrick. And Lonzo, did you find her exact employment date? Do you remember what that was?
Yes, ma'am. It was October the 15th, 1979.
That is to be continued. She was not going to be here tonight, was she?
No,
But we do want to recognize her.
Yes, ma'am.
All right. Next on our agenda is the presentations for Ballot Health, Russell County Medical Center presentation. Gentlemen.
Thank you, Madam Chair. Thank you, Supervisors, for allowing us to be here today, tonight. My name is Eric Deaton. I'm the Chief Operating Officer for Ballot Health. And we really appreciate being able to have a few minutes to tell you about Ballot Health and things that are going on since the merger. And also to share with you what's going on at Russell County Hospital as well. So I think we have a PowerPoint, and this is, if I can run this for us. Can't? Oh, there we go. That's creepy. Okay. There we go. I'll kind of break this out into some different areas. First, quality of care. This is for overall Ballot Health, not just for Russell County Hospital. We have a clinical council made up of around 45 physicians across the entire region. These physicians really do focus on looking at the quality of care that's provided throughout all of our hospitals. They are totally and completely committed to providing excellent care, and have recently adopted a zero harm culture, which really means that in everything that we do, we try and put the patient first, make them at the center of what we focus on to make sure that we're not providing harm or creating any type of harm to a patient. Matter of fact, we've even seen a 29% reduction in total harms across the system since we've been a merger. So we look at baseline data and things that took place, accidents or things like that may have happened in a hospital. Falls some more, and we've seen a 29% reduction by having a focus on this and having our doctors work together and look for best practices across the region and also across the country that we can implement within Ballot Health. We also have had a 71% improvement in our quality metrics. We have a number of quality metrics that we were asked to look at from the Commonwealth of Virginia as well as the state of Tennessee when the cooperative agreement was developed. And so we have a number of those measures that we look at on a monthly basis and sometimes on a daily basis. Several of our quality indicators have actually improved by 50% from where they were before the merger. Access to care was also another area that was really important for us, and for our rural areas especially, we're committed to rural health care. And you may have heard we're going to be opening the Lee County Hospital back up in about this time next year. We've already opened an urgent care center there. That's been very, very busy, similar to the urgent care center we have here in Lebanon. And so immediate access to care comes through providing urgent care centers and also recruiting doctors. Across all of Ballot Health within the past year, we've recruited 94 doctors, or what we call advanced practitioners, which would be like a nurse practitioner or a PA. We also have increased our screening rates for cancer, diabetes, and hypertension, all things that we all experience and have a high amount of in our region here. So if we can start detecting these things early, we can start treating them earlier, and people have much better outcomes because of that. We have started to have some screening for behavioral health as well. This is done through our emergency departments, where we can help screen people for behavioral health type issues when they're in our emergency room and help get them care immediately as well. We also have, and all of our emergency departments have screened for pediatric readiness to make sure that we can take care of pediatric patients across the region. And we're utilizing telemedicine now for certain specialties that are really hard to bring to rural areas especially, to help our emergency physicians and providers care for our emergency patients more readily. We have substantially reduced asthma ER visits for for ages 0 to 4. That's a big issue, as you know, for newborns and for young children with asthma. So if we can help really focus on the causes of that, work with our primary care physicians, make sure that children have a primary care doctor, a pediatrician. We can really start feeding those things earlier in life. Oops, sorry. Cost of health care, we've reduced admissions by 5.4%. This is really, the focus here is to, again, find the determinants of certain illnesses, make sure people have primary care, and really focus on and reducing admissions to the hospital, which would reduce infections and so forth. That's actually saved $48 million to payers and employers across the region. We've also had a savings of $7 million. We participate with Medicare or CMS for our Medicare Shared Savings Program. We've had great success there through an accountable care organization. We've reduced emergency room visits by 3.8%, and again, many times we've been able to divert people, instead of having to come to an ER to have a higher bill, they go to an urgent care center, especially for those folks who have a lower type of acuity type of illness. And then we've been able to reduce rates in one of our major payers that we'll talk about a little bit later. I'm going to introduce, I'm going the wrong way, Greg. Introduce at this time Greg Neal. Greg is our president for the Northeast Division, and Greg will be talking to you about some things that are going on coming forward within Ballard Health. Thank you.
All right, thank you, Eric. As you said, I'm Greg Neal. I have the privilege of being the president of the Northeast Market for Ballard Health, which includes Russell County Hospital, Johnson Memorial Hospital, Smith County Community Hospital, and Bristol Regional Medical Center, where I also serve as the CEO there. I've been in the area for 29 years, and really excited that I've had the privilege to work closely with Steve, and I want to recognize Greta Morrison is here as well. Steve and Greta really are provide solid leadership to our local community hospital here in Russell County, and we're going to hear from Steve here in a moment. But I want to, you heard from Eric some of the exciting things that have occurred in the last year to move forward our capacity to provide the best possible care for our patients, and that's really why we're here, to make this a healthier place to live, so that folks' dependence on or need for healthcare services is not as great. That would be ideal, right, for us all to be healthier. So some of the things that we're going to be doing to build on that foundation that Eric talked about is for example, this commitment to what we call tiered safety huddles. So every day in all 21 hospitals across the Ballard Health system, we start our day with a commitment to unit-based huddles. So every team, every department across the entire Ballard enterprise meets first thing in the morning and talks about potential areas of concern from a safety perspective, and what do we need to do to make sure that our team members have the tools they need to do their job. And that if there is any concerns with respect to that, they have an opportunity to escalate that. And so we, after that unit-based huddle, we have a hospital-wide based huddle of leadership at every entity across the enterprise. Following that, we have a huddle by telephone with all the hospitals in my market, so I have an opportunity to hear what's going on across the area, and then anything that I need to further escalate on a call with Eric and senior executives from across the system. So literally within a couple of hours, a frontline team member can call out a concern, and that hit the ears of our highest level executives who have the capacity to flow the resources that are needed to intervene in a very timely manner. We've already seen some fantastic results from that. But we're building, I'll not go into as much detail forward, but implementing standardized quality reporting so that we're confident that we're all measuring our quality metrics in a standardized way, and we're leveraging best practices across the entire enterprise. One of those is being this implementation of something called ERAS, or Enhanced Recovery After Surgery. So we found in some of our hospitals that following this protocol, we can significantly shorten the length of stay for patients who've had major surgery. That folks can be up and walking literally hours, within a few hours after what was traditionally considered to be a major surgery where they need to just be in bed for days. Well, we're learning that they actually recover faster if they get up and move. And sepsis is another one of the most significant illnesses that you can have, and it's important that we recognize that earlier, and we have the resources in place. So we have pockets of excellence for that. We're in the process of rolling those standardized protocols out to all of our hospitals as we speak. Continue this focus on reducing total harm. Reinforcing our commitment to rural health, which we certainly have across Ballard, is I'm sure you've heard about our investment in Lee County. We've already reopened just this past month an urgent care center in Pennington Gap, and that'll be followed in about a year. In the next 12 months, we plan to reopen the hospital there, which we're all very excited about. Mental health is obviously a big challenge across our nation, and it certainly touches us here more closely to home as well. And so we're working very hard with the behavioral health resources across the region to make sure those patients get access to the care that they need, and we don't just have them held in our emergency departments without getting truly access to the care they need. So that's part of what that's about. And then, of course, we're excited about our new dental residency program. One of the greatest needs with respect to access to health care is access to dental care. And we've taken a big step toward addressing that through this investment in a residency program where we can train more dentists here locally that hopefully will stay here and be part of the solution. So also continuing this focus on our commitment to not just improving quality, but lowering the cost of care as well is really important. We've budgeted, we're planning, is our aim to continue to reduce what are avoidable admissions to the hospital, as Eric alluded to, opportunities for us to connect with folks earlier before disease processes progress, chronic care conditions get out of hand. We know that we can avoid admissions. We've had success this past year. I think you heard him say we've reduced admissions this past year by over 5%. We're going to try to reduce them again another 3% this year. That alone will save employers, payers, individual patients an additional $27 million in out-of-pocket costs. We're further going to focus on reducing ER visits by 6%. Again, helping folks get to lower costs and more appropriate settings for their care. One thing we've done that's going to be significant is standardized our physician charge masters. So coming from two legacy systems where we had different charge structures for different groups of physician providers. Now that we've integrated, we've standardized those, and as a result, lowered what will be the out-of-pocket costs to patients across the region by over $1 million. We want to be focused on enhancing our relationships with area employers and payers around other strategies, innovative strategies to reduce costs for everyone, while we're also improving quality, creating value, if you will. I want to stop here for a moment and introduce Marvin Eichhorn. Marvin is the Chief Administrative Officer for Ballard Health, and he's been very involved with some important work of ensuring access to care, continued access to care for the citizens of Russell County. So, Marvin.
I don't know how to get rid of that thing. Right. I'll blame it on you. Well, good evening. As Greg said, my name is Marvin Eichhorn. I'm the Chief Administrative Officer for Ballard Health. One thing I wanted to mention, this is the only slide I've got, so I'm going to be really, really brief about this. And certainly if you've got questions, we're going to have to take questions at the end if there are questions from the Board of Supervisors. But one of the things that I've been very involved in, along with a number of other folks within the system, is what's mentioned up here, that I think as y'all are probably aware, at least in working with Dr. Brown, I know certainly in working with him over the last 7-8 months, was where y'all probably had a number of discussions about this within the Board of supervisor, but the health insurance plan for the school board and county employees, if you go all the way back to August of 18, a decision was made to, in essence, not use a healthcare network. The particular network that the county and the school board had at that time had all of our valid hospitals, physicians, other things that valid doesn't. Of course, when the decision was made to not have a network, obviously became a problem, I'm sure, for certainly us and certainly for probably your employees and dependents as well, because we went from being in network to actually being out of network. And so what we did during the period of time that it took both to find this out, which took about 4 or 5 months on our end, as well as to work things out with Dr. Brown, was that intervening 11, 12 months, we did not bill anybody that got care at one of our facilities or went to see one of our practices. And so what we were worried about, because of the fact we were out of network, there'd be higher out-of-pocket costs. Now, as I'm sure you're probably aware, about 7, 8 weeks ago, we did get things worked out with Dr. Brown as far as settling up, so to speak, about what the cost was going to be of health care for that period of time between August 1st of 18 and the end of, what I got up here, the end of August of 19, which, as y'all know, on September 1st, what the school board and the county did at that point in time was went basically back in network with the same payer that you were formerly in network with prior to coming out of network back on August 1st of 2018, which we viewed as a good move. As I said, you know, Ballot Health, through either Ballot Overall or Wellmont Health System or Mountain States Health Alliance, all the entities we were prior to the merger, we are in network with, you know, essentially every payer there is in our region. You know, there's been nothing we have done to go out of network with anybody, and so we were certainly grateful that the decision was made to go back in network with that particular payer. And then, of course, what we worked out, as I'm sure you're probably aware, is we did make a decision, and by the way, Dr. Brown's an extremely good negotiator, to basically reduce our rates even below the rates we had with that particular payer that you were in network with before. And so certainly, hopefully, that was viewed as a positive to the county as well as the school board. And so with that, I will turn it over to Steve Gibbons and let him talk a little bit about the hospital. Thanks.
Good evening. It's very good to be here tonight. I'm looking forward to talking to you a little bit about some of the great things that are going on at Russell County Hospital. Let's see. All right. So the hospital's been in the community for over 70 years now. We have 78 beds at the hospital. We provide 165 jobs currently. In fiscal year 19 was about $8.7 million in salaries to those individuals. Of course, those salaries that are earned by the team members not only supports them, but supports their families, also contributes greatly to the economy of Russell County. In fiscal year 2019, we had a total of 1,712 acute and psychiatric admissions. You can see the breakdown there. We actually, contrary to what's going on in the rest of the system, actually had an increase in the last fiscal year in both our acute admissions and a very significant increase in our psychiatric admissions compared to the previous year. We also, as you can see, we're experiencing significant growth in our outpatient areas. The growth in our outpatient is largely coming from oncology services, from imaging services, from our lab and from our sleep study centers. But we are continuing each year to see quite a bit of growth there. And then our ED visits have been fairly stable over the last 3 years. This is a listing of the services, or some of the services that are offered at the hospital. I just wanted to mention a few things that have happened since the merger was complete. Number one is cancer care. We've expanded that service since the merger. Cardiology coverage. Our cardiology outpatient office has also expanded coverage. Our sleep centers, there were 2 sleep centers here in the community before. We merged those together, both close to the hospital campus. By combining those together, we're able to get that those centers are accredited now, and also with our accreditation, we're able to take care of Medicare patients with our sleep centers now, which we weren't able to do before. So that's been a nice enhancement. And then also our orthopedic clinic is now operating a walk-in clinic where you can walk in each day with no appointment and be seen in our orthopedic clinic that's located there at the hospital. There's been no, since the merger, there's been no reduction of services at the hospital, no elimination of services at the hospital. There's been quite a bit of capital investment. There's going to continue to be some capital investment at the hospital. Since the merger, we've invested about $750,000 in various activities. One is our cancer center expansion that I mentioned. Clearview Behavioral Health, we made some changes to that center to make it more safe for patients. The sleep lab combination that I mentioned, and also just some other building and security and equipment enhancements just to the infrastructure of the facility. We're also planning at least $1 million in capital investment this fiscal year. We're going to be replacing our rural health clinic, or building a new facility for our rural health clinic in St. Paul. It'll be relocating basically just across the street from where it's located now. And then we also, one of the things that's happened since the merger is recruitment of an additional outpatient behavioral health provider to our rural health clinic that's located in St. Paul. Last week we celebrated, had an open house for our cancer center. With the expansion, we added 2 new exam rooms. We've replaced all of the infusion chairs in that space with new state-of-the-art infusion chairs and more space and new furnishings throughout the clinic. And also, as I mentioned, our Center for Sleep Disorders is now accredited by the American Society for Sleep Medicine. We also, in addition to that accreditation, we also now have an on-site provider at our sleep center, and patients are able to be seen there rather than have to do follow-up visits outside the community. The rural health clinics, so we've opened a second rural health clinic here in Lebanon. It's just right across the street from the hospital. And just like the clinic in St. Paul, it offers both primary care medicine and also behavioral health services. And then our cardiology clinic has gone from 2 days a month to 4 days a month in the community. And then also I mentioned the walk-in clinic for the orthopedic clinic. We have over 55 physicians on our medical staff, 61 allied health staff. We actually have 7 Russell County High School graduates that are part of the medical staff now. And so we have a lot of familiar faces that are working for us. These are some of the folks that you see around the hospital and in the clinics, and some of our other providers that we have. Our team members also recognize the need for time and resources to improve the lives of those who live and work here, and the hospital actually promotes health and wellness through community events and coalitions. And some particular ways we do this are through working with the Russell County Health Coalition, doing community health screenings. We recently did a community health screening at the Elk Garden School Ministry. We also do health screenings each year at our holiday health celebration, and also at the Senior Safety Expo that is done here in the community. We also support a number of other agencies in the community, the American Cancer Society, the Chamber of Commerce, Rotary Club, United Way of Southwest Virginia, EMS, and law enforcement. This year we've been providing flu shots, sharps containers, and drug boxes and refills for EMS and for law enforcement. The picture there is something that we did during our team member campaign this year. I was coerced into kissing a pig as the team met a particular fundraising goal for the hospital this year, and it was very significant, because we raised more than $18,000 to support various funds across the area, and a lot of that was going to United Way of Southwest Virginia. So I was more than happy to kiss the pig for the team members this year. We also support youth in education, Future Business Leaders of America, Imagination Library, National Honor Society, the playground equipment. The picture here is actually the ribbon cutting for the playground equipment at Lebanon Elementary. We also support the Russell County Star Child program and the Bear Buddies program. We're going to be starting right after the first of the year. And that's where we're going to have volunteers from the hospital go into the primary school and elementary schools to work with children that are having challenges with learning to read. So we'll have volunteers that will go in and read with them. And we're also involved in the community through a number of other events. Bicentennial celebration we were heavily involved in this year with the town of Lebanon. The Christmas parade, we've been involved since its inception with the Farm to Table dinner, the Haunting on Main, the Homemaker Redbud Festival, July 4th, the Russell County Fair and Horse Show, and of course the Russell County Coal Bowl. This is a picture of there. And lastly, I just wanted to mention, as many of you may know, I've announced that I'm going to be retiring from the hospital at the end of this year. It's been a hard decision to make, but my wife and I both think this is the right decision for us right now. So we'll be retiring at the end of the year, and we'll actually be moving out of the community. It's certainly been a privilege to lead the hospital since November 2012. It's hard to believe it's been that long. And I've just really found it very rewarding to work alongside with our great team members that we have at the hospital. I really get to see how much they care for the patients and care for the community, and really are dedicated to what they're doing within the community. I also know that Ballard Health is committed to Russell County and our hospital, and will continue to deliver exceptional care in the capable hands of our caregivers. So at this time, I'm going to invite Greg back up for a few minutes, and he wants to talk with you just a few minutes about the leadership transition at the hospital. Thank you.
I'll be very brief. I do want to recognize Steve's contributions to the hospital, specifically here in Russell County, but also to Ballard Health and the entire system. He's somebody who advocates tirelessly for the community here and for the hospital and our team members. He's just had a broad influence on our entire health system. So we're so thankful, Steve, for your years of service to the community here. I know all of you join me in wishing him the very best in his retirement. Look forward to someday following in his footsteps in retirement. But I do want to reassure the Board of Supervisors and the community as well that while this transition is not something that we saw at all, we will take the opportunity to make sure that we work very closely with the hospital board. I was hoping Ms. B. Stewart, our chairperson, and Randall Hillman, who's a past chair, I'm working closely with the two of them and the entire board to ensure that we have a smooth and orderly transition. We have the best leadership possible in place to ensure the continued great work that's been occurring under Steve's leadership the last several years. So with that, we'll conclude unless you have any questions for any of us.
I do have a question. Something I think that would be a great benefit to Ballard. Russell County had started an initiative called the RACE program, which we pay for the first 2 years of education for every child in the county to go to Southwest Virginia Community College. And within that, they have to pull 100 hours of community service. And with our nursing program at our vocational school actually at the college too, I think it would be a great opportunity, a great partnership. I know through economic development and out here working to try to bring companies and jobs into Russell County, a key component of that is medical care and quality medical care and the facilities that we have in our portfolios to demonstrate what we can offer in Russell County. So, education, economic development, and quality medical care is, those three essential things are kind of the staple to help move what we're doing here in Russell County by attracting new industries and providing good quality jobs for our people. But I do believe that our children deserve an opportunity first at home. And if there's a way that you guys could partner in relationship with that, I think it would be a great opportunity.
Sure. Greta has been working closely with Southwest Community College even before the RACE program. Each year we have availability at the hospital, positions for the student nurses to come and work at the hospital. And then we've hired a number of them after they've completed their training and passed their boards. We've hired several of them and they are working at the hospital now. So we very much want to do that, and they work throughout the system. It doesn't just have to be at Russell County Hospital. But we've been very fortunate to have some really good nurses that come to join us with that program. So,
Oh, great. Yeah. And I commend you for that program. That's fantastic, and we covet the opportunity to continue to partner with you.
Thank you.
Can I ask one question?
Yes, sir.
Great, thank you and you, Jim, thanks about and talking to us. And one of the things that Russell County Board of Supervisors, you had mentioned in your slide presentation about the transition of Lee County. And one of the things that Russell County Board of Supervisors and Russell County citizens wanted to ensure that continued service would continue at Russell County Hospital. And that's what we wanted to hear from Ballard at the time. And that was one of the reasons that we invited you here, to ensure that we're not in the transition in the next 5 years based off y'all's COPA. That's, if that was going to be part of the transition, we want to ensure that we continue as a partner. That's the first question. Second question is, you mentioned 2 rural clinics, and are both of those on a sliding scale in both rural? Because that also needs to be communicated to the public, and we might be able to help you with that, because that's a big advantage of 2 rural clinics sitting in one county. That's a big advantage. Yeah, thank you.
Absolutely. Yeah. Well, I hope you, on your first question, I hope you felt some reassurance, seeing evidence of our investment in the community as we invested in growth and expansion of a number of services. Most recently, the oncology program, the cancer center, and our commitment to that, to invest in building another rural health clinic, as you mentioned. So absolutely, there's no plans to for diminishing services here. Excited about the future of our presence here.
Thank you very much. Thank you.
Thank you.
One question for Steve. Was that a pink vote?
Yeah,
All right, Steve. Just
that
one.
was Clarabelle with me in the picture.
I commend you for that, Steve.
Thank you.
Thank you.
Thank you. Appreciate it. Thank you very much. Appreciate it. Thank you.
Thank you. Thank you.
Enjoy your retirement.
Now we have Spearhead Trails with Melissa Rose. Is she in back? Spearhead Trails. Melissa. Okay. We'll move on. Next, we have board appointments, and this is to the Russell County Community Policy Management Team. Mr. Jeff Bentley and Lonzo Lester. And Jeff is the region-wide director for behavioral health programs, and he currently serves on this board now, and he is one of those positions that it is mandatory that we have him on this board, and we do have an application for him. So,
Madam Chair, do we need to
yes.
take these separately?
Do you? No, not really. We could do this together because it is Jeff, and his is one of those positions that's mandatory, and then it's Lonzo Lester, and these are both 4-year terms.
Well, I'll make a motion that we accept both of these points.
Second that motion.
All right, second by Steve. All right, all those in favor?
Aye.
Anyone opposed? All right, thank you. All right, next thing is the approval of our minutes from our October 7th meeting.
Madam Chair, I'll make a motion that we approve the minutes as presented.
We have a second.
Second.
All right, all those in favor?
Aye.
Anyone opposed? Next, we have, approval of our expenditures. We need to pay our bills. So do I have a motion to approve the expenditures?
Madam Chair, I make a motion we approve expenditures this month.
All right. We have a second. Lou? All right, any discussion? All those in favor?
Aye.
Anyone opposed? All right. Next, we have our citizens' comment period. Please limit it to 3 minutes. Is there a sign-in sheet? Kevin, will you check the sign-in sheet, please?
I am on the sheet, and in the interest of time, I'll be quick and go ahead and say the library is starting to work on census support, because we know we're going to be ground zero for that. And I just wondered if the county had created their census counts committee yet. Have y'all?
No, currently, right now, the county is working with Cumberland Plateau, so we're doing it as a regional thing. So we're getting ready to go into that. There was actually a meeting this morning from the governor's offices. It was a small conference. So we'll begin starting with Cumberland Plateau, and then we'll move into the logistics and what we have planned within the county. Yes.
All right, we have Carly Ramsey from Rosedale. You'll state your name and your address, please, for
Carly
Vicky.
Ramsey, and I live in Rosedale, Virginia, Rosedale Estates. And I'm here on behalf of our traffic up there. I think though Becky has called me, and it's currently been passed, right?
Well, and I will speak to this. We did meet with VDOT on Route 80 from Rosedale at the traffic light up past the store there, going down the hill, down the doubles. They have looked at doing a reduction in speed limit and a traffic study count for us, how many commercial entrances, how many subdivision entrances, the store entrance, and they are doing a study for us. And the sheriff also met with us on that day to say that this is needed, and VDOT is pulling the stats for us and pulling all the data, and I think it's going to be something positive. They will be hoping to reduce the speed from the traffic light at 19 and 80 at Rosedale all the way down past the doubles, past that store. The very morning that we met, there was 2 bumps that morning, so that kind of put a little more teeth into what we were asking for. And I'm happy to report that they were all willing to do it.
Well, I know when I first moved there, the traffic wasn't this bad, but it has multiplied. Everybody realizes that, and we do have an accident most every month. It's getting unsafe to come out of my home there. So, but I think it's gonna happen. Becky keeps me updated. She called me twice. I appreciate that. Appreciate all that had anything to do with this. Made it happen.
We hope it happens.
Maybe it will happen.
Okay, next we
Thank
have,
you.
thank you, dear. Next we have Edward Tiller.
I'm Edward Tiller. I live on Big A Mountain, about a mile and a half out of Homemaker on Route 80. And I'm here, it's some more people here that they live up on Amber Drive, I believe. Amber Hill Drive. And whenever it rains, the road gets full of water, and somebody's going to have an accident if something ain't done. And we're here maybe to ask them to help us fix the road up on the hill. And I don't know how you appropriate your money. They have appropriated one time to fix the road, and they sent the money somewhere else. There's no drains up there, and ain't no ditches, and we would appreciate if you could help us out and do something for us. If it ain't something done, somebody's going to have an accident. And I'm not much of a speaker, but when you get the money, let me know. When you get ready to build it, just let me know. I appreciate it.
You're not telling it all.
Huh?
You're not telling it all.
Well, I'm telling the best I can. A lot of the water, when it rains, it comes over on in my yard, and it's
We got a pond behind our house.
well, it's washed it out, and I know you can't do nothing, snap your finger, but we'd appreciate if you could help us out.
Mr. Taylor, I'd like to speak on this. I had talked with VDOT and Eugene and some more with Tim, and we've talked about that ditch there across from your house.
Yeah.
But it don't help, they come and done the ditch. I
Yeah.
don't care how deep you dig that ditch, the water don't come out of that ditch. It comes on the main road because they blocked it up on the hill. It don't hit the ditch line.
Yes, I've talked to them about Amber Hill Drive also.
It don't hit the ditch line. The water don't even come in the ditch line. It goes by the ditch line on the main road. I have called VDOT. I could not tell you at the time because of high water in the main road. The main road on Route 80.
Yes, I've reported that 2 or 3 times.
But we'd appreciate if you guys could, ladies, could help us out, and I'm sure you work it and get done pretty quick, probably, I'd say. And we appreciate it. And if it was ditched and greens put in, I believe it would make a difference. It would help. And there's hardtop on the hill where they go up that hits where the water comes right down the road. It's just breaking all to pieces. And I used to live up there, and I live at the foot of the hill now, below it, but there used to be, I don't know how the law is or what, but there was a 50, if I ain't mistaken, there was a 50-foot right-of-way around the subdivision, and somebody said you have to get everybody to sign. I don't know how it is, but we'd sure appreciate if you could help us out. It's really needed. And just give me a call when you get ready to start.
I'll be right there. And I'm not sure if I'm reading the next one right. Monica Gonzalez, 350 Indian Hills. Okay.
Yes, Your Honor. My name is Monica Gonzalez, and I live in the Belfast area. I represent the civil servant that you spoke about in closed session, and I wanted to know when he would be able to expect an answer as to whether or not he would be allowed to return to work, or whether or not he'd be dismissed. I understand that there's several members of the courthouse today here expecting an answer and looking forward to seeing him soon in the courthouse. And I understand we've also provided packets to you all, and I'm not sure if they were provided to you all.
Yes, please.
I did provide the packets to the board members that you provided. There will not be an answer tonight. I do know that you're legal counsel and you've submitted a letter to the Board of Supervisors representing as such, and you will be copied on any official correspondence related to the employment of the individual that you represent. But that's all the information that we have at this moment.
Will there be a time frame to which you will receive that information?
No, we do not have one right now, but all I can say is you will receive a copy of that information that will be provided to him as well.
And will there be a thorough investigation with regards to the videos that could be seen with regards to whether or not any of the allegations could be true, inaccurate, or not?
I'm not going to further comment on any kind of investigation that involves any personnel in open session, as that is for his protection. So.
And I apologize, I'd asked to be invited in closed session, and I was not, so I...
Excuse me, ma'am. It's not a answer question session for us. Sorry to hear. All right, next we have is oligay breeding. Is that correct?
Mostly. Edward done told you mostly what I
need to say.
Well, good evening, Board of Supervisors. Nice to see you all.
Would you give me your address? Would you give me your address, dear, so I can write it down? Your address.
You need my address?
Yeah, just.
Oligay breeding, I'm 88 Amber Hill Drive.
Okay, same one. Okay, all right.
I'm Amber Hill, right above
Thank
where
you.
Edward.
You're right above Edward. Okay, thank you, dear.
So he was explaining about the road. I guess that's why it's going down on him. I'm not a good speaker, so just forgive me for this.
You're fine.
I said, when you get older like me, and we've got some elders up on the hill that needs our road fixed really bad. I mean, we don't have a husband now to do a lot of it. So we do need our road fixed on Amber Hill Drive, and fix the water so it won't be turned on Edward and all the people down below us. But we've lived there for about 47 years, I guess, and we've been over here several times to the Board of Supervisors. But we've not got our road fixed yet, so I hope and pray that somebody, you all can help us some with that road. We sure do need it. And we love every one of you. It's a big one. And I'm not a good speaker, so I'm not gonna make it long, just a few minutes. And I hope that you can help us, and we sure would appreciate it. And thank you for everything.
Thank you, dear. Thank you. All right, anyone else, public speaking, there's no one else on the sign-in sheet, but is there anyone else in the audience that would like to speak? 3 minutes, citizens comment. Anybody else want to speak?
Well, I would like to say they are, like I already said, we live here, but we've got a lot of elderly up on the hill, widow women. That when that hill is bad.
What's your name and address?
Linda Killer.
Linda.
Edward's wife.
The other half, right? The other half. Got you, dear.
But we've got several elderly women up there that is widow women, and when it's cold and that hill is slick, they cannot even get off the hill. Katie knows. Katie used to live up there. So you guys, Katie.
She's Katie's babysitter.
But
be careful,
that's what worried. That was what worried. But we got off the hill. We had land enough at the main bottom of the road. We got, and honestly about it, it was because of the hill was being so bad. But we've got 1, 2, we got 4 widow women up there, and when it's bad, they have no way to get off that hill. No way whatsoever. And if they had to have emergency, County's rescue squad won't go up and get it. Because it has been so bad, Edwards had 4-wheel drive, and he could not even get up the hill coming home from work. That's how bad that road gets at times. So, we're gone.
Thank you, dear. You have to work for your community, I know. All right, anyone else that wants to speak, citizens comment, please. All right, seeing none, we'll close that. Any constitutional officers' reports or requests? County county attorney reports and requests.
I don't have anything at this time.
Thank you. All right, county administrator reports and requests.
Thank you, Madam Chair. First, I'd like to start off with, on the county administrator reports and requests, is the 2019 VACO annual conference, which is from November the 10th through the 12th. This is at the Homestead in Bath County. So I think Mr. Eaton will be attending, and he will be representing Russell County with legislators during this time. All the local legislators come together and look at the future budgets and legislation that will come before the General Assembly. Second thing is on the county administrator reports is the project management services RFP advertisement that we released them to for the county. That closes November the 20th, 2019 at 2 p.m. This was approved by the board, and this is for information only. So it will close November the 20th at 2. Next is the Russell County drought relief resolution. The Board of Supervisors was concerned with the local farmers, and we put in a drought relief resolution that would give assistance to the local farmers during this time in conjunction with the USDA and the natural resources and the service farm agencies and the Department of Forestry. This was happening during the drought situation, so the board also implemented the burn ban in the drought in assistance. Next.
Do you need any action on that?
That was actually you guys to make it more expedient. You give a resolution, yes. This is the one that the extension office, Scott Jesse, came and discussed with us, and we give approval on. Next is the support for the Tobacco Commission Pastures for Profit, another assistance to the feeders. The Russell County Board of Supervisors fully supports the Abbott and Feeder Cattle Association grant application to the Tobacco Commission to assist regional agriculture producers with pasture improvements. This is a letter of support that was pre-approved by the Board of Supervisors last time. This is the scope and the terms of the letter of support, which was eligible for expenditures to include lime, potash, fertilizer, grass, seed, and certain amount of lime equipment. And the Board of Supervisors supported this. Next is the Belfast Waterline Extension Project Phase 2, letter of intent funding. This is from the Virginia Department of Housing and Community Development for the 2019 grant offer for the Belfast Waterline Extension Project Phase 2. This is the grant for the $630,000 in grant money to build the water line extension into the Belfast area from the Governor Northam. There is a follow-up meeting on this within next week to hopefully proceed with this extension along with the USDA and the Office of Drinking Water.
Do you know when that will start actual work on the water project?
After discussing with one of the things that DHCD was really impressed with in Russell County was the ability for Russell County PSA to do force count work and the number of linear foot they can move per day. So now that the PSAs have been combined, they have an extraordinary construction crew, and to give an exemption to Russell County, because a majority of the other 94 counties in the state of Virginia, they usually contracted out. Mr. Breeden will concur with that. With our workforce, we can proceed quickly. We can do a lot of things that will not hold up current work that is in this situation because the force account will be able to perform it. That's why we're having a meeting next week to be able to proceed with this.
Do you know exactly when next week we will have this meeting?
Right now, I am waiting on the DHCD. One of their members have been out. We kind of caught them by surprise on how fast we could move with force account movement. And he's trying to get his schedule together, and I'm hoping it will be the middle of next week.
Make a statement about force count. Force count is using their own crews to actually install the water line, but what we've seen in the past over a large number of years they've been doing this, they've been able to save, it depends on the conditions, but it's probably averages around 30%. 30% reduction, which means that they can put more water pipe in the ground for the same amount of money. So it's been a big asset.
And that was one of the things that surprised DHCD. What we were not paying to contracts work, we can lay an additional linear footage in water line. So what money we're saving, we're moving it dedicated into the community, which is the Belfast community, which is a really good project. This is, by the way, this is not the only grant money on this. This is $630,000. There's actually $920,000 in total grant on this. There's no loans on this. It's 100% grant. Next is the Route 80 speed and traffic study that we had looked at before. Last week we met with VDOT and the Sheriff's Department. We discussed these line item number 6 and 7, which is the Route 80 speed study and traffic, and the VDOT and the Sheriff's Department community work program, litter pickup program. But on the rate study on and the traffic study for the Route 80 project, that is proceeding. There is a little bit of work going on. The Rosedale Baptist Church is adding on an addition, so they're trying to take time to look at the subdivisions, the businesses, the retail store, the convenience store that's there, the church is there, and the new entrance is there. So they're wanting to make sure that they have enough traffic control mechanisms and measures in place to be able to handle the additional future traffic in that area. Now next is the VDOT Sheriff Department Community Work Program, Litter Program. As everyone has noticed, if you haven't, we've been working on it. The Russell County had an exemplary litter pickup program with our community work program. And we had partnered with VDOT during that time, and I was hoping VDOT would be here tonight. And I want to first thank VDOT for participating in this. The Sheriff's Department supplies the deputies with the community work program. And we have come together and developed a program to where there will be crews of 10 along with our deputies out picking up litter. And I want to thank VDOT for funding this. This is 100% funded and paid for by VDOT on the deputies. So our community work program will be performing the work for their community service. VDOT will be paying for the deputies' time. And now we can get Route 19 and 58 and 80 cleaned up, and the secondary routes. So these are going to be crews that will be designated on certain routes, and all three agencies will be working together. The Russell County Community Work Program, the Sheriff's Department, and VDOT will be working simultaneously to make sure that we keep this program running.
When will that start, if I may?
Right now, we are working with the Ms. Wallace, we are fine-tuning some of the paperwork through the courts, through Judge Moore. We're hoping within 2 weeks that we can get this program back up and active.
Thank you.
Yes, ma'am. Next is the Russell County pre-orders and payment of cans. There has been some request that has come into the county administrator's office for ordering pre-order cans. So just FYI to all of our residents, if you have orders for cans, because we have to have a minimum order before we purchase, go to your local canneries, fill out the applications, purchase, give them a check for the amount of cans that you want, and we can go ahead and order those for you. We'll be glad to do it, and it's at cost, no cost to y'all. Next is the VDOT Route 681 notice of intent. This was on the last agenda with the Board of Supervisors, and there was no action that was done on it. There were some questions on it, so I went back to VDOT and I had them to submit their discontinuance notes for further consideration. This is a request on it. And as y'all can see, there was a large amount of notes on the Route 681, the circumstances of what was involved, why they come to that decision, what future things that we should consider, and that's up for the board's discretion.
Okay, Madam Chair, may I ask a couple of questions on this? Yes. Thank you for the clarification. I was totally on the wrong end of the street. And so my question is on a discontinuance. I know that VDOT has not maintained it for 20 years. I understand that. But I just want to clarify that I'm understanding this correctly. So it may be eligible for re-addition. I'm not expecting it to be put back into the VDOT system. But what about our trail system? If there happens to be a trail that comes off that way, I'm just wondering what we do about that. Like an ATV trail maybe, or a walking trail. I don't want to close the door that we couldn't be able to use that. So that's just a question I want to pop out there. And if you am I understanding right, on a discontinued, it's not going to go back to the center line of what was the road, and then the people on each side would end up owning it. Is that what's going to happen?
It will go back to the original property lines. Now,
Yeah.
Some are to the center road and some are not. Some of them are extended over, yes.
Okay, so there's a possibility that when this goes back to the original landowners, so what if that was coal company? I'm just asking.
No, those are very good questions, because in that area, it could be a possibility, but there is a but here. There is an easement in there. Is that what you're concerned about, is the easement?
I just don't want to close any doors that could make a trail expansion through Trammell Gap across the mountain up that way out of the downtown area of Dane and reach into Clintwood and on further into Hayside. That's what I'm looking at is, if we don't expand this thing, it's not going to work for the whole region. So I'm just asking. I don't know. Because that is an old rail bed up above that.
It is. And I'll have to go
I'm
get
sorry.
more clarity. No, these are questions that we've got to ask. Let us do a little bit more research on this one, pull it a little bit more to see what's in the deed. And see if there's any covenants or restrictions on this. But I'm not going to say it's like every other piece of property, because I can't do that, because every one of them is different. Every one of them. One of them has their own covenants.
Okay.
So I'll have that ready for the board next
We're
time.
back at it again. All right.
It says in this letter law, though, that they advertise for public hearing. If no request for public hearing are received prior to November the 9th, the item will be placed in the Commonwealth Transportation's agenda for its next meeting. When is that next meeting? Is it December? So we can't act on it until the next meeting.
Until the next meeting. See, administrative authority is transferred to the county, but the discontinuance does not obligate the county to perform the maintenance activities on the road. VDOT will post a willingness to hold a public hearing as required by law in the October 9th edition of the Lebanon News. See, it was the 9th one. If we tabled it for further consideration.
It was last month.
And this time we will table it again for further consideration.
Okay.
But all I'm saying is, are they gonna miss their deadline for this next transportation, Commonwealth Transportation Board meeting?
And that's okay, that's not immediate priority.
No,
There's nothing that's going to close down, you know,
They'll just pick it up.
CTV, yes, sir.
Gotcha.
Yes, sir. I'd rather get all the questions and answers and the easements and all the concerns out of the way. The CTV will move this in a blanket movement.
Yeah, because I've been looking at that as a piece of Contura / Alpha property. And I didn't realize that it was in the VDOT system, because I had not researched it to that point, I guess. And I didn't see the paperwork on it where it was, because I asked you about it last time. I thought it was totally on the other end.
Almost sounds like you're giving it back to the county. What is it? In that letter, it said we would not be responsible for it.
I
I
know,
think the state is giving back to the county.
but then it comes back down here to this discontinuance, and so I'm confused on that.
We need to clear out.
I might,
It'll just become a private road.
Yeah.
Because they're either state maintained or private. So it'll become a landowner.
Be the landowner.
Who would own it?
It's a landowner.
Landowner.
It goes back to the original land.
Yeah.
That's the way it works.
That's the way I thought.
I don't know.
Center of the road is just right here.
I might be married to a land surveyor, but I can't answer that question.
If the state had it, it had to own 50 foot, it wasn't abandoned. The state had it. It looks like to me.
Right, just got
Can I say something, Harry?
Yeah.
I believe to check that the state took prescription of the easement. The state can abandon maintenance of it, but that doesn't give up the easement.
That makes
I
sense
think
too.
you're right. The easement's
That
gonna
does
still
make
be
sense.
there.
That's why I
It's
said-
only
That's
a
what you're
30-foot
saying,
easement.
easement will still be there.
That's what I was
Yeah,
saying.
the easement will still stay there.
And if it's maintained, it's up to the county to maintain it.
I don't remember the exact details from years ago, but there's discontinuance and there's abandonment. And I think from what he's saying, abandonment takes the maintenance from VDOT, they abandon maintenance, and that becomes up to the county to maintain. But if it's discontinued, then that property goes back to the previous landowners.
But you have to have hearings, and then I think it has to be a court action.
That's what they want to do.
That's what they want to do.
And so I'm trying to put the brakes on the discontinuance thing.
Yeah.
Well, we just need to table it and look into it, and we'll see next month.
Yes, I just need clarity on that. I don't want to close, I've had the door closed on several occasions on several things that we've been working on, and,
This
just
is
don't wanna do
FYI.
that.
This
Just
is,
FYI.
yeah, the reason I put this for no action is because tonight is the first time you've looked at VDOT's notes on abandonment or
Okay, thank you.
discontinuance. So, if I will notify VDOT that we did not take action on it, but like they said, if it's abandoned, it can't be converted back to the county because we were never the owner of it. It will go back to the original property owner.
And I was under the impression when I got here a couple of years ago that the county had no roads.
That is correct.
Okay.
So therefore, it will revert back to the property.
But there will be an easement, because
Yeah.
it says administrative authority is transferred to the county. The discontinuance does not obligate the county to perform maintenance activities on the road, so there has to be
Right
an
away or
easement.
something.
They're
There'll
not
still
giving
be
up
an easement to
they're
it.
giving up the work.
There'll still be an easement across it.
Yeah. Next on the county administrator reports, and is the Russell County Health Coalition, is the Family Health Expo on November the 7th from 3 p.m. to 6 p.m. This will be held at the Russell County Government Center, and we encourage Russell County citizens to take part in this. It has flu shots, vision screens, hearing screens, A1C testing, activities, and of course, they're going to give you, if you take a flu shot, they're going to give you free food. So. The ladies about to like that, didn't they? So, remember, November the 7th, to participate in the flu shots. Very important. Next on the county administrator reports is the Russell County Heart of Appalachia Board member resignation. We had a resignation that was effective October the 18th. That was formally sent into the Heart of Appalachia. So there will be one vacancy on the Heart of Appalachia Board for the Board of Supervisors.
Do we need to accept that, make a motion to accept that, any action? Do we have a motion to accept Ms. Betsy Gilmer's resignation from the Heart of Appalachia?
I'll make that motion.
All right, Harry, do we have a second?
Second.
Steve, thank you. All those in favor of accepting her resignation?
Aye.
Anyone opposed? All right.
Next on the county administrator request is, the next one is also a resignation from the Department of Social Services. This is from Laura Rasnick. This is effective upon completion of the 4-year term, effective on the November 1st.
All right, do we have a motion to accept her resignation? It's due to her health.
So moved.
All right, Tim?
Second.
Second, David? All right, all those in favor?
Aye.
Anyone opposed? All right.
Thank you, Madam Chair. Next on the county administrator request and reports is another resignation by Kim Short, our current Russell County Tourism Coordinator. She is she is effectively resigning November the 11th, 2019. She will be now serving with in employment with the Heart of Appalachia. She will be serving the region rather than the county. I need an acceptance of resignation for November the 11th.
Yeah, we have acceptance of her resignation.
Make that motion.
Steve, do we have a second? Carl, all right, all those in favor?
Aye.
All right, and happy to report that she will be the social media director for the Heart of Appalachia. So she is taking a new position, and she will be still working with us.
Yes. Thank you, Madam Chair. Next is, as mentioned before, this is the termination of the declaration of emergency on the burn ban termination. Russell County, Virginia terminated the local emergency burn ban effective October the 21st, 2019. The local emergency burn ban was implemented in response to the fire hazards and drought conditions that created extreme fire danger within the county. The burn ban was a result of an extremely dry September with no significant rainfall predicted. This declaration of emergency due to dry weather conditions in accordance with section 44, 146.21 and 15.2, 922.1 of the Code of Virginia is hereby terminated and open our burning ban in Russell County. I need a motion for this.
So moved.
All right, David, do we have a second? Lou? All right, all those in favor? Aye. Anyone opposed? Hey, it was very dangerous there for a while.
Next on the county administrator reports and requests, of course, is the authorization of the PSA Water and Sewer Operator Business Plan and Rate Study Contract. This is an award to the Lane Group for performance meeting the requirements of the consolidations of the PSAs per the Virginia Resource Authority and the Department of Health that is coordinating and paying for this study, for the new rate study and the new business plan. I need a motion and approval.
I'll make a motion, we accept this and authorize the contract to be signed by the appropriate party.
I'll second it.
Second. All right, all those in favor?
Aye.
Anyone opposed?
Thank you, Madam Chair. Next on the county administrator report and request.
Air Green, the local emergency management performance grant.
trying to be patient with this. This is the first time we've had this technology up, and we're trying to get them all coordinated. Next time it will be.
We have, Jess Powers has received a grant for the county, and it is $15,000. So we need a motion
Yeah,
to
we got it.
accept.
I'll make that motion.
All right, David,
Second.
a second, Lou. Any discussion? All those in favor?
We also had a couple added.
Yep. Well,
We had those two that we added.
yeah.
That's why it's getting ready to go.
Should have been 20 and 27, 30.
Yeah.
It should have been 20 and 21.
Should, okay, yep, that's right, I'm sorry, I
No, you're fine.
apologize,
You're fine.
I apologize. That was, we need to change the numbers on those, wasn't it, just
20 and
20 and 21? Okay, I'm sorry. We have more things added, okay.
Next on the county administrator reports and requests is another grant. This is the 2019 State Homeland Security Grant Program. This is for $49,741. This is a Russell County Emergency Management Operations Center grant for equipment. I need appropriation authorization for $49,741.
So moved.
Second,
Second.
Steve.
Discussion.
Okay.
I just have a question on this, and maybe I'm off base, and I apologize if I am, but does this go to help supplement maybe emergency centers with bedding and food to get them approved? The folks that are, where does that go? Give me a hint.
This grant it is part of the operations center, but it will be dedicated to emergency equipment for trailers, communication. It has to be designated for that type of thing, and for the offices and centers for a command center.
Yes, within the grant, but does that mean that that will supplement the cost of our local fire departments and EMS folks? That won't help that at all, will
No,
it?
that's
Okay.
under the fire grant program. That's a
Okay,
separate program.
just- thank you.
Yes, ma'am.
Most of this grant was due to us moving Jess in his own building.
Yeah, that's right.
Okay.
And that qualified before we did qualify for it because he had no place to have meetings in a disaster. So it's really helped getting him into a building of his own.
And he can train other emergency directors from other counties. They can come here and do training, and it offsets the cost for that.
It was a much needed office.
Yes. And next on the county administrator reports and request is another grant for $10,377. This is
We didn't vote.
Oh, we didn't
on it.
vote.
She said discussion.
Yeah,
Sorry.
discussion,
Sorry
that's
about
right. All right, we had a motion, and David did it, and then Steve seconded it, and we had discussion. Now, all those in favor of accepting the $49,741 emergency management grant?
Aye.
Anyone opposed? No. Thank you, folks.
Next is a grant from the Department of Environmental Quality. This is again for the litter prevention and recycle program from July 1, 2019 to June 30th, 2020. This is for this $10,377 is to be split up between the County of Russell for $6,887, the Town of Cleveland $1,021, the Town of Honaker $1,021, and the Town of Lebanon for $1,448. I need a motion for appropriation and allocation.
So moved.
Steve, a second.
Second.
Carl? All right, any discussion? All those in favor?
Aye.
It will be divided among all of our entities in the county, all the towns in the county.
Next on the report is a planning commission plat for Mr. Gary Dodson from the planning commission. This is a division of the lot. I need approval on Mr. Dodson's.
I'll make that motion.
Gary, do we have a second?
Second.
Tim? All right, all those in favor?
Aye.
All right. Now, here's where I messed up on the numbering, folks, and I apologize to you all. I put it in the wrong place, the wrong numbers on Lonzo's reports. This should have been, this is where we had, Steve made the motion to amend the agenda. It was to revert money back to the county, and then it should have been 21 instead of what I had, 14 and 15. So 20 is reversion of money back. Lonzo, you want to talk about that?
Yes. Item number 20, which is a request from the Virginia Department of Health for the end-of-year settlement. This end-of-year settlement indicates that Russell County had a balance for the fiscal year of 2019 for $22,660. The balance is a result of collecting more revenue than we projected and the underspending in the FY 2019 budget due to unfilled positions and spending cuts. This is a request by the Virginia Department of Health that it was a supplement of revenue to revert back to them during this time, but the Russell County Board of Supervisors Budget Committee actually, with all the agencies, state agencies and local, held everything to a flat level funding and kept everybody in no one else got any reversion funds back. So that should be the standing position of the Board of Supervisors and the Budget Committee. So
Put this money back in our general funds.
So
Make a motion, we put the money back into the general fund.
Second.
Second. All right, all those in favor?
Aye.
All right.
The last thing on the county administrator request is a surplus Russell County Sheriff Department truck vehicle that is to be dedicated, transferred to the town of Cleveland for utilization by the town of Cleveland.
I'd like to make that motion.
I'll second
All right, all those in favor?
Aye.
Anyone opposed? So we will be giving that truck to Cleveland to be used for their trash collection.
No warranty on that.
No warranty, as is.
It is yours.
Thank you, guys.
And again, that concludes the county administrator reports and requests. Madam Chair.
Okay, now, thank you, sir. Now we have matters presented by the board. Tim, do you have anything you want to say, dear?
Just one thing, once everything is up and going with the new Russell County PSA, and Steve and I have talked a little about this, just would like to look again at the Copper Ridge project, and I'll do whatever I can to help with that. It's much needed.
Probably after Christmas, we'll pull that one out. I've got to pull all the files out. I've got them all accumulated there. We'll sit in and go through and see what we get in.
Anything else, sir? Lou?
No, I'm good, thank you.
All right.
Imagine
Imagine that.
Sean, it's the holiday.
I forgot about those.
Yeah, that's what
I'd just like to
sent
encourage
you a
everybody to let
notice.
them take them already.
Okay,
I don't have anything.
all right.
I want to
Steve?
bring to attention everybody's, we looked at the numbers on the regional jail, and Rebecca and I had a meeting, and Alonzo had a meeting today with Judge Moore. And as a result really of a housing meeting that was held earlier, well, it was last week, I guess. When you look at the numbers on the regional jail, we were budgeted at 100, I think it was what, 168 Alonzo?
Yes, sir.
That would be our average residence. Right now, we're bumping along about 183. And now, that didn't sound like a big difference, but considering that each one of those inmates results in about $15,000 worth of cost, what you end up with, if we go along at that rate, and end up at that 183.88 or 184 inmates, that's going to cost us about $230-some-odd thousand additional. Tim knows what I'm talking about, on the regional jail. So what we would like to do, we'd like to look, we're told that the drug court can expand if they have some housing facilities. Rebecca and I met with Judge Moore today and talked about the possibility of seeing if we can secure some housing for some of these people. Every person that we can take out of the regional jail and put in some alternative type program yields about $15,000 a year in cost savings for the county. So I guess we just, like the board's okay to go ahead and pursue this. And nothing will be done until we come back before the board, with some sort of proposal.
We just, after that meeting, we need Lonzo to look at the numbers of how many inmates we have, how long they're there, what's the cost, and pull together a little report to say what's the projected figures and what can we do to alleviate some of this cost. So that's all we're wanting you to do, is to look together and see what we can do and make a report for us next month.
Yes, ma'am. And one of the things I want to convey is the Russell County Board of Supervisors is looking at an annual $300,000 grant, another grant to be able to, sustain this. So this is part of the process. The Department of Behavioral Health and Developmental Services came and spoke to us, and we're going to pursue trying to get some other assistance and grants with the helps of the core system and the community work program.
My line of thought on this is rather than put it into the regional jail, if we have to use money, we need to reinvest it here in Russell County. I don't think a whole lot is accomplished by incarceration, that we need these alternative programs that are teaching people how to work or helping them through the recovery process. And that will break some of the cycles that we're seeing right now. I'd much rather invest on a local level than send it over to the jail.
Mr. Ferguson, you have anything to say?
No, I don't think so.
All right, with that, our next meeting should be December the 2nd, here at 6 o'clock. So do I have a motion to adjourn?
I'll make that motion.
David, do we have a second?
I'll say.
Carl? 5 with an executive session needed. Okay. Next, December the 2nd at 5 o'clock with an executive session. Maybe David, who seconded? Carl. All right, all those in favor?
Aye.